So what is targeted heart rate aerobic exercise? So this is what I had mentioned before. So if someone fails the Buffalo concussion treadmill test, they're very exercise intolerant. So in these people, we tell them to do targeted heart rate aerobic exercise, which is simply performing aerobic exercise, which is either walking, jogging, or straight cycling at a level that is subsymptomatic. So aerobic exercise, there are actually a lot of different types of aerobic exercises, but not all of them are recommended in these situations. For example, I actually recommend stationary cycling over regular cycling in acutely concussed patients because, well, these patients have a concussion. They probably have balance problems. We don't want them to go out on a bike and doesn't just fall over and get another concussion. Side by side, even though, for example, swimming is a phenomenal form of aerobic exercise, a lot of my patients have actually reported that as soon as they get into the water, their balance dysfunction just starts getting like really, really bad because, well, you're in water and you don't really have a good sense of proprioception. So, uh, in those situations, we really ask the patient what they're willing to do and what they can do. Okay. So, targeted heart rate aerobic exercise is typically set at 80 to 90% of the heart rate threshold they were achieved on the graded insertion test. And we tell them to do for aerobic exercise for at least 20 minutes a day. This is what we call the Buffalo protocol. Okay. Now, I say 80 to 90% because a few of our clinicians are so against the 80%. They're like, oh, 80% doesn't work. Only like, I only tell my patients to do 90%. Whereas some of my other clinicians, physicians, they say that, oh, 90% is too bad. We only use 80%. That is so much better. So in these situations, I tell you guys, use 80 to 90% based on your clinical judgment. So we've done lots of randomized control trials and we have shown that this is effective. However, it is dependent on how adherent the patient is to their exercise interventions. Now, um, it is very, very important to like understand that your patients are humans, okay? They're not just lazy. If they're not adhering, that does not mean that they're lazy, at least not most of the times. These people are concussed. They're probably going through like other therapies. I mean, their vision is probably really bad. They probably have like neck issues. You know, in these situations, we let the patient, like decide themselves what they want to do. We don't want to like stress them out too much. Slowly increase their exercise capabilities as tolerated. So this is from my one-pager exercise prescription forms. All of these exercise prescription forms are formally published in peer-reviewed medical journals in the Clinic of Sports Medicine, but they're also available free of cost from my website. Now, the ones that are actually available on the Clinical Journal of Sports Medicine, or I just took a snippet of this, they actually have a mistake. So where it says how were your symptoms before exercise, there should be a 0 to 10, but in the both of these places it says 1 to 10. So that's the one mistake over here, which you will not find in the downloaded forms. So what I do is this top table over here, I first like to educate my patient. Okay, I want to give them set goals of what they think they can do and make sure that these are achievable goals for them. Okay, so what I do is I report their age and I calculate their age appropriate heart rate max. So this is the Karvonen formula. Okay, so if someone is 20 years old, I specifically chose 20 because that's going to give the most round decimal numbers. So their predictive heart rate max, 220 minus 20, 200. Okay, so that is their predicted heart rate max. And then in the subsequent stages, I write down what each stage would be. Now, the thing is, this is not the stage of return to play. So I really, really apologize if anyone gets confused with that. This is the stages of when they can reach 80% of their heart rate max. So stage one would be 50%. So 50% of the 200, that's 100 over here. Stage two, 55%, that's 110. Again, 120, 130, 140, 150, 160. So when a patient comes to this stage at 80% of their age appropriate heart rate maximum, this is when they can begin the stage three of the return to play protocol. So by making these stages and explaining to the patient what they're achieving, we can actually let patients guide themselves on how to like progress their exercise prescriptions. And most of the times, athletes are really, really motivated if you to do these exercises if you explain it as targets like this. Now, side by side, I also tell my patients to keep a daily symptom diary. So, for example, if the female that I originally spoke about, the 15-year-old female who got symptomatic at 150, so there would be 220 minus 15, 205. 150 would be approximately between stage 4 and stage 5. So in that, for that female, I would tell them to start day 1 on stage 4. What is the target heart rate they want to achieve? How were their symptoms before the exercise? So hopefully they're at low symptoms. How were they after the exercise? And what stage they will try to attempt tomorrow. So I'm actually going to explain the progression and stopping criteria in the next slide. But it's very good to have this in like a one-pager summary. So when like the athlete comes back to you on like maybe a weekly visit, or maybe if you're seeing them every like 3 days or something, this is, you can actually review these daily symptom diaries to see if the patient is recovering at a normal and healthy pace. So when to stop? Okay. So if you experience any increase in your concussion symptoms by 2 points on a 0 to 10 scale, this is when you stop. I have made these one-pager handouts for patients. This is easy for people to read from like a 6th grade reading comprehension onwards. So this is what I tell them. So if they do not experience any worsening of their symptoms, then they can progress to the next stage. But if they're experiencing just a little bit of symptoms, then stay in that stage for like a few days until those symptoms don't happen. But if their symptoms are getting really bad, like a 3-point increase or more, then scale back your exercise prescription and then start from a lower intensity. Okay, so here is results of our randomized controlled trials. So this was the first trial that Dr. Letty and I published on, and this paper already has approximately like 500 plus citations. By far, one of my most widely cited papers. So in this patient, this just shows how effective aerobic exercise is. So this is a Kaplan-Meier survival graph. So the x-axis in the bottom over here, this is time. So this is day 0 from injury, and this is day 30 from injury. So if someone comes to this point are still symptomatic, then they're the ones that are considered to have PPCS or delayed recovery. So there is our stretching group, there's our aerobic exercise group. So in both patients were seen on a weekly basis. Both did the graded exertion test at their initial visit and at every subsequent visit. However, one group was told to go and do at least 20 minutes of aerobic exercise at home, and the other group was told to do a similar time duration of stationary stretches. And we found, so as soon as someone recovers, this percentage starts going down. So, they're not concussed anymore. So this blue line starts dropping a lot faster originally, and by day 21 onwards, there's barely anyone left. Only 2 people were still left in this trial versus approximately 7%, which is closer to 15% or 15 to 16% versus 4%. So prescribed exercise reduces the duration of symptoms as well as the incidence of PPCS. So this study has been replicated at Harvard, at the University of Pennsylvania, as well as dozens of other things. And then fortunately, so many people have actually replicated our studies that we've been able to do a systematic review and meta-analysis to do level 1 level of recommendation that this is successful. Okay, so why is exercise beneficial? Again, technically no one really knows, but it is theorized to maybe it increases cerebral metabolism, maybe it can increase cerebral blood flow. Some people say that, it increases neurotrophins in the brain, like exercise is associated with increases in BDNF. This can maybe cause brain repair and healing. Whereas some people think that, slowly stressing and then de-stressing the body with exercise leads to a training effect. I mean, that's literally the definition of rehabilitation. The thing, however, no one exactly knows how exercise is beneficial. We just know that it is very, very beneficial. So in this situation, more research is always needed.